Ann. I'm Mary, occupational therapy assistant student with Nashville State. How are you today?
I'm good.
Good.
Thanks for asking.
Yeah. So today for our session, we have a new diagnosis for you, and the diagnosis this time is schizophrenia. So I'm going to just kind of go over with you what that has looked like for you, where you are, what kind of setting you're in, and then go over some treatment ideas and options, explain the condition to you, and things like that. Does that sound good?
Sure.
Okay. So you have recently been diagnosed with acute schizophrenia, which led to a hospitalization in a psychiatric facility. You were there for 1 month while you were kind of being stabilized on some medications. And now at this point, you are functional with supervision, which means that you are able to do kind of your daily activity things, taking care of yourself, taking care of your home, that kind of thing, with supervision, which means that you might just need somebody there to just give you reminders and cueing you for safety, things like that. And your relatives are a little concerned about you remaining home alone for long periods of time after coming out of the hospital. So as a result, you've been referred to a day program, which has a contractual occupational therapy service available to you 1 time a week as part of the program. During that time, you will attend the program 5 days per week for a full day, and that will be for 1 month. After that, the plan is to reduce you to 3 times a week for a full day for another month. So 2 months total for the day program, starting with 5 times a week and then 3 times a week in the second month. And then hopefully after that, you would no longer need day supervision and you would be able to kind of function normally within your condition. So some of the goals that we are going to address with you within your short-term goals, so within the first month, we want you to demonstrate the ability to take medications and on schedule with indirect supervision. So that means that you don't have somebody necessarily watching you directly and monitoring it, but maybe, we're checking in with you periodically. Did you take your morning medication? How did you do with your medications? Just somebody to kind of give you that indirect supervision. We also want you to participate in the day program social and leisure activities. And I should probably backtrack a little bit and just kind of explain a little bit with the psychiatric schizophrenia. You are prone to having delusions or false beliefs about things happening, hallucinations or sensing things or seeing things that aren't really there but they feel real to you. Some disorganized speech, rapidly shifting between topics of conversation, kind of jumping all over the place, repeating the same things over and over, and just not making a lot of sense necessarily with your speech. And then disorganized behaviors as well, so childlike and silly behaviors, or you could flip to more aggressive and violent behaviors, unusual actions, freezing in place potentially, and an important one as well, not responding to instructions or communications. And that's kind of where we can get into a little bit of challenges with being able to function day to day and getting you some treatment. So we'll definitely work through that. And also withdrawal from social settings. So you tend to prefer to isolate, which isn't necessarily a good thing because that can lead to depression, anxiety, and things like that. So keeping that in mind, demonstrating the ability to take those medications on schedule is going to be very important because those medications are going to help you manage those symptoms and being able to function. Then participating in that day program and social leisure activities without exhibiting schizophrenia symptoms. The medications are going to be key for that. So that's why, managing that medication schedule is very important. Participating in day programs and your daily activities like your cleaning of your house, your laundry, those kinds of things, without exhibiting schizophrenic symptoms as well. Again, that's going to be better managed with proper medication. And then planning programs, tasks, and activities for days at home when you're not attending the day program. So, looking at keeping you busy, keeping you active, keeping you able to take care of your home, and, grooming, bathing, those kinds of things are going to be important. Then after that first month and after you've achieved those goals, we want you to independently take your medication at home and during the day program with indirect monitoring again. Follow the home program of task and activity performance. So we'll set up a program for you at home on what you're going to be doing, and then have that indirect monitoring. So maybe somebody checking in with you daily, how did you do following your schedule today? That kind of a thing. Completing your home IADLs safely and independently, cooking, doing your household chores, things like that, making sure you're safe with them and independently, again with that indirect monitoring. And then participating in some of your formal social and leisure activities when you're not at the day program. So looking at some of your hobbies that you have, walking the dog, taking hikes, short little hikes, things like that, reading, some things like that we've discussed in the past that you've enjoyed and doing that have not been possible for you since your hospital stay. So some of the problems that you have exhibited have been difficulty managing your medications because of your disorganized behaviors and inability to follow directions. You've had difficulty managing behaviors which interferes with your ability to complete your IADLs, your home care activities, laundry, cooking, things like that, safely. So that would be another thing to keep in mind as we're working through your treatment plan. And then isolation because of your episodes, which is interfering with your ability to engage in social and leisure activities. So we'll work on addressing those as well. To do that, some of the activities that I have selected for you is to create a weekly calendar to maintain cleaning and laundry with a checklist. So we'll sit down together and decide, how often do you want to, vacuum or, do the dishes? Is it going to be a weekly thing, once a week, a daily thing? We'll sit down together and discuss that, and then create a calendar with a checklist so you can kind of have that visual reminder of what to do and when to do it for you, to just kind of help you with that. As far as your medication management, we will set up a weekly medication dispenser. So I don't know if you know what those little pill boxes are, kind of a thing. So we'll set up a weekly thing where you've got it all organized, AM, PM, midday, depending on what your schedule looks like. We'll get a dispenser that works for you. And then I also would like to set up phone reminders on your phone, just as that reminder of when it's time to take them, because it's going to be really important for you to stay on top of that in order to be able to function in all of the other areas. So we'll work on that. And then as far as keeping those leisure and social activities, which is some of your goals, we are going to be looking at setting up maybe 3 days a week for you to take your dog for a walk, just to get out and enjoy some fresh air and do that. And then I would like you to explore some community programs or clubs that offer some activities that are of interest into you, whether it's a garden club, a Bible study, something like that, that you could investigate, and then just select one to participate, even if it's once a month, twice a month, just something small to get you some more connection with people and help you to keep from isolating. Okay? Any questions on any of that so far?
Nope, I don't think so.
All right, sounds good. So one other thing that I'm looking at for you, and this is going to be, so I'm going to see you once a week. And then in the meantime, I have a home exercise program for you just to kind of help keep you engaged while, in between the times that we're working. And I thought and did some research, and yoga is actually a really great thing to help. There's been some studies that show that it can be beneficial just with your cognitive processing, your emotion regulation, and things like that. So I have an exercise program for you with very simple yoga poses and exercises that I'm going to give to you that you can just follow along just maybe once a day, just to keep you, working in the right direction. Okay? Sounds good. As far as discharge planning, the goal for you after these 2 months in the day program is that you will return home. That's our goal. We want you to be able to function at home independently, maybe with that indirect supervision for a while, until you feel you're safe to be able to manage on your own. How does that sound?
That sounds great. It's a good start.
Okay, perfect. Well, if you don't have any other questions.
I don't.
Okay, perfect. Well, I'm looking forward to working with you and help you continue on the right track and getting you able to get home and be independent.
Thank you so much.
Okay, thank you.